kidney stones are where some of the chemicals that our kidneys produce as waste products clump together and form stones. So akin to cement, putting it into water, some of those chemicals will get washed out as dust, and others will clump together to form hard bits of rock or stone. So kidney stones are often formed when we aren't drinking enough fluid. They can be formed by certain dietary elements or some anatomical elements in terms of how we're built. And there are a number of different ways to treat and manage them through diet, lifestyle, and sometimes surgical interventions. So for most people, stones develop within the kidneys, and I like to think of it almost like your hand, where you've got little fingers within the kidney with the kidney around it, and then you've got a tube that comes down towards your bladder. Stones that form in the tips tend not to cause pain or problems, and those stones slowly over time will grow, and then they will drop into that tube on the way down. And often when it's in the tube is when we get pain or discomfort, which can be quite sharp, quite severe. Often it means that patients will end up going to A&E as an emergency. And from then onwards, it's what tests we need to do. Some patients might get temperatures or fevers, which means that you need to seek help as an emergency, because you can get infection behind. But for most, it's going to be sudden severe pain, which comes and goes, almost like stabbing pain within your back or going down towards your groin. So kidney stones are diagnosed partly on history, but mainly on imaging. And we would normally want to either consider an ultrasound scan or a CT, which allows us to look at stones, the number of stones that you might have, the location and the size of the stones. Different stones can be treated in different ways, and there are several different types, but for most, we can either watch and observe them, and smaller stones are likely to pass without treatment. The larger stones can be hit with shockwave treatments to break them up, or we can go internally to break them up with a laser, where in a minimally invasive way. Very occasionally, for the very, very large stones, you can have something called a PCNL, which is creating a larger hole into the kidney through the back to take out bigger amounts of stone in one go. So the treatments will vary depending on what type of stone and the size of stone that you have. The biggest lifestyle change to help prevent stones is hydration. So for most people who form stones, they have to drink at least half a litre more than the average person. And for most, we're recommending drinking between 2.5 litres of fluid a day to try and prevent stones. For others, it's a low salt diet, increasing the amount of fiber, fruit and vegetables in your diet if it's a calcium oxalate type of stone, and then trying to limit the good stuff, so the meat, cheese, wine, fish, poultry, processed foods to smaller amounts, and where possible trying to avoid fizzy. So surgery is necessary if the stone is causing a blockage and causing pain as an emergency. Surgery is necessary if a stone is not moving or not wanting to pass over a period of time of monitoring, or if patients have had stones before and they are unkeen on keeping an eye on them. Surgery can be the shockwave treatments, which is through the skin with the patient awake with some painkillers to try and fragment the stone into smaller bits that you will then pass. Other options would be to go internally with you asleep, to go up to the stone and laser it using flexible telescopes and lasers, or the PCNL option, which is the larger procedure to try and take out bigger stones.